Bismillah ar-Rahman ar-Rahim. Dear brother and sister, Assalamu alaikum wa rahmatullahi wa barakatuh. It is my great pleasure to be with you here at this virtual meeting. I'll be talking for the next 10 minutes about the low vision services delivery management. Well, like I said before, probably some of you already providing a low vision service at their clinic, and some of you have uh, willingness and interest to start to do some services. So we'll be going over the updated local statistics about people with vision impairment and the importance of having low vision service, as well as provide you with some of the or share with you some of the personal experience in setting up the very first vision rehabilitation center at the East Mediterranean region, which is IPSAR Foundation from the year, what I have worked with from the year 2003 until 2015. We were able to provide 100 of low vision people efficient services, allowed them to continue their daily living with improve the quality of their living. To begin with, well, let's review together the national data statistics, which was introduced in the year 2017, and that's the latest one they had. It suggested that 830, it was, or actually it was founded 830,000 people are facing difficulty with vision from minor to severe, and nearly 75% of them are eligible for low vision services. Another study indicate also that 3.9 of the population over the age of 50 are facing low vision, or actually they are already low vision. With these numbers of low vision population, yet the low vision number of people would be increasing due to many reasons. I'm sure all of you aware of it, that refractive error is one of them, diabetic retinopathy, glaucoma, cataract, genetic diseases, and some other eye diseases as well might cause the increasing of low vision. With the number of we have and those causes, yet the low vision services in our country for the time being is facing really challenges. I mentioned some of them, which is lack of awareness among community, as well as the lack of trained staff and finance support and facilities, and other issues. So what we are going to talk about for the next few minutes left is how to overcome those challenges based off the personal experience with setting up the first vision rehabilitation center, which I mentioned earlier, is IPSAR. To begin with, low vision services delivery management, and this need, step one is to create awarenesses in the public as well as the community, and that's what we began with back in 2001 by inviting businessmen, providing data, highlighting the issues of the importance of providing service to people with low vision. Number two is you have to select the right staff. Right, selecting the right staff, I mean, well, you might have a professional people, optometrists, ophthalmologists. They do a great job in other fields, but they really don't have the patient enough to be with the low vision patient. So that will not be a fun and enjoyable job for them to do. And then we have to have the right training. The low vision clinical care training, the comprehensive one, which contain the basic of the low vision services process in terms of clinical evaluation and rehabilitations and etc. all other things, and having the right clinic is also a very important. I would recommend a 6 meters long clinic Well, and even though some of the days there's some they used 4 meters, but 6 meter long is an ideal. Will allow you to have the patient examining in a real distance, and you are able to create good lightings and use all kinds of devices and electronic magnification in your clinic to use it while testing the patient in comfortably and an easy, and also you'll have enough comfortable space for the patient partner, who is very important also to involve. Well, when we set the clinic and we want to start to deliver the service, two things would make your job extremely easy and successful: is the support staff, who is going to provide the after the pre and after the services required with the patient, and the facilities like teaching room, or you might have teaching space in your clinic, but it's more ideal to have a teaching room with a rehab specialist to work with the patients after the clinical care. And the forms, it is really the key, the successful key of having your service management flow easy. And start with the refer form that the eye primary care, the eye doctors, how are they going to refer the patient for you. It is important to have a very effective form, which should include diagnosis. Eye acuity is a very good piece of information to have, as well as the visual fields. These things should be in a referral form from the eye clinic, so you know where you're going to start from. And then you have to also develop the other forms for like history, for referring the patient to the rehab specialist, your recommendation to the school if you have to. All these forms will make the service management very good, and you have to work with your staff to develop them and start to work with them. Well, we are going to need also the orientation and mobility. You have to have a very good coordinator, clinical coordinator, train them about devices, give them orientation about eye diseases, and so that they will be your right hand in having your work easy and smooth, breathing before seeing the patient and while working with the patient, and after you sending the patient or referring the patient to the other uh, facilities. Once you completed these steps, you really need to do the awarenesses part in organizing and conducting campaigns and annual low vision clinical care courses with faculty from inside or outside the country. The devices issue is you have to have connection with good companies who have all the devices and electronic magnification and daily living skills tools and utensil and adaptive technology in hand, because if the patient leave your clinic and they're not able to get what you prescribe them, they'll be demotivated and they will never try hard to get it again, and then your time was really waste. So it's very good to have connection with a very good reliable companies. However, it is good to be updated about what's going on in the devices and electronic magnification industrial, and is your patient in desperate need of your advice in what to get and what to do and how. These are the a very quick summary about the low vision surface management, and it's really great fun to work in low vision area, and this is something humanitarian path, you like making person to have a better quality of living. Uh, I really thank you for your time and for your attention. And I'm going to leave my contact available for you. I welcome any consultation you might need about reach out to companies or reach out of patients on or any of the forms you might be interested to deliver for your clinic. And thanks again, and thank you for your attention, and bye.